Welcome, welcome, welcome. We're going to get started here in just a few minutes. Welcome. Please share so that other people know that we're here tonight. Tonight we're going to talk about some good nursing topics. All right. Well, who is here? Who's here? Who's here tonight? Hey, hey, come on in. Who's here tonight? We're going to get started here in just a few minutes. I'm going to let a few more people to come in. The ones who are here, if you don't mind, just saying, hey, 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 how are you all doing? Miss Good, I think it's Miss Good. Um, Nurse Ultron. Oh, hey, how are y'all doing tonight? What y'all been up to? Y'all been working? I'm enjoying my last few weeks off before I start school in 3 weeks. Before I start teaching in 3 weeks or 2 weeks, actually. I think I'll go back in 2 weeks, August 6th. So we are going to. I'm going to actually put on here my IG so y'all can see that. I want to follow there as well as TikTok. Hey, Miss Renee. Hospital giving. You know what? I'm not really following. I'm not gonna even lie to you. I'm not really following COVID as closely because of the fact that I am not working in the hospital at the moment. But I believe it is because is it because of this new variant as to why it is, or do you feel like it's because of the people who are not vaccinated? We can have a true conversation here. I won't care one or the other who's been vaccinated and who's not. I'm not really about checking people like that. Everybody makes their own decisions. But what is your opinion on that, Miss Renee? How are you doing today? Good. Miss Good, did you got an A on your AMP test? That's good because make sure you learned your AMP good. It's a foundation for nursing. It's going to take you if you're going to have a very good understanding if you know your AMP. That is great. That is great. Stay hype. Stay hype. Keep reading, keep pushing. And I just posted this on TikTok about some ways to help. Amazon has um Amazon has coloring books that you can get coloring books and then AMP for dummies and flashcards. That may help you too. Sometimes the coloring books help, just if you're creative mind where you need to just be doing something and it's more interactive. Amazon has some great books online for AMP specifically. Wow, so pregnant women. So let me ask you this, and younger people. I can see the younger people. Do you mean younger people in the sense of like the ones who like children who can't get vaccinated, or younger people who just won't because they don't think it can happen to them? Miss Good, you're right. I mean, I'm glad you're excited. Let me tell you something. I'm gonna be honest with you. You're going to at some point, you're going to lose motivation, and you may not be as excited every day, but you will have to remain disciplined. You'll have to remain disciplined. So Be mindful of that, and that's true with anything in life that's worth having. Exercise, even you lose motivation all the time, but you have to remain disciplined. So, um, hi, is Mr. Cotterell? I think I said it right this time. Cotterell, Cotterell. I think that's how you told me last time. Hey, how are you doing? Mid adults. Okay, so like maybe 40s, 30s, 40s. Some of us can be stubborn still. So, do you think it's due to the new variant, or you just think that you said unvaccinated, pregnant women? I wonder. Because I do OB. So I wonder, do you happen to know if pregnant women? I don't think they've been cleared to get the vaccine yet, but do you know in your practice or what you see, are they cleared to get the vaccine? Pregnant women? How's everybody doing tonight? I'm so happy to see you all. Um, okay. We talk about anything. Right now we're talking about the fact that people are not getting vaccinated and that the rise of COVID has went back up. Hospitals are getting full again. So I was just simply asking the nurse Ultron what their thoughts were regarding why. Was it because of unvaccinated people? Was it because of young people? And then they basically said that pregnant women are on the rise, which I was wondering about. Could they get vaccinated at this point? Here in Tennessee, I have seen physicians actually offer pregnant women the vaccine, but it's not been approved yet. I don't believe for um, pregnant women. I believe it. I believe. If I'm wrong, correct me on that. Correct me. I have no problem being corrected because I don't know. So let me tell y'all, if y'all let me make sure underscore. This is my IG, and then TikTok. Let me tell you. So on TikTok, I this was a rough week on TikTok. Why? It was because of the fact that because I had announced that I had it was talking about something else about my doctorate, and people took issue with that. A lot of people take issue with the fact that nurses, people, lay people, and people who are just uneducated find or feel that we should not use the title of doctor. We've earned it if we're not a medical doctor. So that was a big to do this week on TikTok. So I go through explaining to of course there's some trolls, people who just want to be negative anyway. But I go and explain to people that non-medical people like doctors or physicians do not own the title of doctor. They don't. And even though they think they do because they have a complex, that's not my problem. So I'm up here trying to say, I have my doctorate, this, that, and the other. I will be addressed as such, Dr. Marita P. or whatever. And people really take issue with that. And if you recall, the first lady, Dr. Jill Biden, went through the same thing for her doctorate. She can't be called by her title because she's not a true medical doctor. So those are some things, there's some hot topics that's going on right now, at least on my TikTok. I'm going to actually put that on there so you can join over there. If you should ever choose to, because we talk about all kinds of stuff, nursing stuff, of course. But I find it interesting that people really have a hatred towards um, people who's non physician, as if it doesn't have to mean the same thing. So it's I don't know. We're gonna have to get better. Society's gonna have to get better with that in terms of understanding that physician does not own that title. So let me get my. Right, that's my TikTok. They're all haters. Now there are some people like four who they're like, oh, I did not know you can get a doctorate as a nurse, and we can get a doctor as a nurse. People didn't know that, so I use it as an educational tool. But there are a lot of trolls over there, so it is what it is. Hey Justin, how are you doing? Oh, I'm so sorry about your mom. But you know what? Sometimes things like that really do make you feel like, okay, you know what, this is how I want to give back. So, in respect of your mom, I could definitely understand as to why you want to give back. So you just change to the BSN. Social work is hard. People don't think social work is hard, but it's hard because I've worked with social workers just because of the fact of, of course, nurses. If you do community health, we work with social workers a lot. It's hard, but welcome to the nursing side. So have you actually changed majors yet, or are you doing prereqs or what? Where are you in the process? I'm doing well, Miss Renee. I'm fighting people in TikTok world, but outside of that, I'm doing fine. Chris, I'm doing well. How are you? I'm doing well. Like I was just saying, I'm fighting people in TikTok world because as a minority, we find that we have to work a little bit harder to defend what we've earned because people don't think we can earn some of the same things that everybody else can earn. But outside of that, then it is what it is. I'm good. But it is what it is. I'm working this weekend coming up. I'm doing clinical this weekend. And on Monday, I actually will have a video on my clinicals from last weekend, so y'all can watch that. Some of y'all can watch that if y'all are interested in that, just to see what I do when I'm in clinical with my students. Of course, I can't show any students or any patients, but you get a gist of what's going on while I'm there. But outside of that, I'm doing okay. I'm excited about being here. I love actually doing these lives of just to meet new people. Um, but Justin, I'm actually excited to see how where you are in the process. Are you definitely doing your prereqs? Which, if you were already pursuing social work at first, you should have some of them done. So hopefully a lot of those will transfer over into the program, to your nursing program for you. And if you don't mind me asking, where do you think you want to work? Or like what area of nursing you think you want to work? So those of you who are already nurses versus the ones who are not nursing school, what is your opinion on everybody going to med surge first? What do you think about going to med surge first, right out of school and then choosing your specialty after that? Because that's a big taboo topic right now, or not right. It's always been a topic, even since I was in school. That everybody feels that you should go to med surge first and do, a year or so of med surge, then go into another area of nursing if that's what you choose to do. Me personally, well, I didn't do that. I went straight into OB because that's what I wanted to do. And they were hiring and they were training, so I just went straight to OB. But that's a big deal to some people. So, like, what do y'all think is should we allow it? Should we not allow it? Like, or should people do it, or just do what's best for them? Because that's something that a lot of these new grads feel pressured into going into something they want to do. And I don't buy into that. Now, I would not recommend someone going like um into like let me think of an example. Somebody asked me the other day about hospice, and as a new grad, do I recommend going into hospice? I don't recommend going into hospice right out of school. I recommend like they go do something in the hospital first, learn how to care for a patient who's living, and then learn how to adjust to someone who's transitioning. It was my comment to them. Whether they do it or not, that's up to them. But okay, so you feel like it's a foot in the door. Basically, it's like the foundation for others. Yeah, I agree. I do agree. I just feel like to each their own. You went straight to ICU and ER, and I'm sure they trained you, and you're doing well. Do you have any regrets? Do you like looking back now? Do you feel like, okay, you know what? Maybe I should have did that med surge first before I went to ICU and ER. For me, I have no regrets. And keep in mind for postpartum, or what I do is OB. That's a specialized med surge. It's just women. So when you think about the fact that, okay, if she has hypertension, guess what we take care of? If she has like whatever they have in regular med surge, we have that too, except we don't have per se um kidney failure or heart failure. But I have had some patients, they're rare, they come around, that have had heart failure, and we just take care of them too. Hypertension, diabetes, people who have blood clots, everything you can think of that happens in the regular med surge world happens in the OB world, to a certain extent. So really what I do is I specialize in med surge anyway. And then of course I take GYN patients, which is female surgery. So anything female surgery wise. So we do bladder prolapse, ectopic pregnancies, hysterectomies, things and such, like that. And those patients sometimes are older. Sometimes they're 80 years old with a bladder prolapse, and we got to put the bladder back up in there. Well, the doctor does really. So, I've taken care of those kind of patients as well. And you have to give them their insulin and medications, blood pressure medications, and all. So for me, I'm good. You said you have no regrets. Okay, for 21 years, you got me beat. Okay, I've been a nurse for 17 years. Um, I've been a nurse for 17 years. So, yeah, you got me beat. That's wonderful. I'm glad you're still here. That's wonderful. You said you're finishing your BSW. Oh, okay. Oh, okay. So you about to have another degree. Okay, I like that. Okay, so you doing the thing. So you are going to finish your BSW first. You're going to have, and let me tell you something. That degree right there is going to. I have a degree in psychology. I have a BS in psychology, and I was in the same situation you are, where I only had about a year and a half left, and realized this is not what I was going to do, psychology wise. But so I went ahead and finished the degree and then started nursing school. So you know what? That's exactly what I did. And you're going to be amazed about how much your BSW is going to help you with dealing with people in nursing. Because I'm sure you're taking some sociology classes. I'm sure you're taking some psychology classes and things like that. And those classes are going to definitely help you in nursing, the nursing career, not per se nursing school, but nursing career, because it helps you understand how people think and how they act and why they do what they do. So you're going to understand addictions better. You're going to understand why people, doesn't mean you agree with it, but you understand that people who are addicted to drugs, most people don't get on drugs and say, you know what, I think I'm going to do heroin today. They're coping with something. They have an issue. So when that happens, a lot of times, we understand that. Again, don't have to agree with it, but that is what it is. Do you know why nursing school is similar to boot camp? Yes, I do. I do. It's because of the fact that just like boot camp, I'm thinking you're speaking military. The way boot camp works, and I've never been to boot camp, and I'm not military. I've never been military, but I do. My brother, my nephew, they have been to the military, and of course, we've seen videos on TV or movies on TV of how they basically break you down, strip you, and then they build you back up. So when they go in and cut your hair and do all that stuff, when you go to boot camp, that is their way of stripping who you were and then building you back up to how you need to be a soldier in that situation. When it comes to nursing school specifically, it's kind of the same mindset. We are going to strip of who you were, your mindset. We're going to kind of go even clean slate, and then we're going to build you back up to be a nurse and change your mindset to be a nurse. Now, how they go about doing it, sometimes it's not the best. Sometimes they're not the nicest. Well, boot camp is not either. When you have drill sergeants, they're not nice either, per se. But a lot of times you will find that if they are good instructors, they are hard, but they are good and they mean well for you. So I don't want you to be, if you're in nursing school now, or you feel kind of intimidated or bothered by some of your instructors, all instructors are not good. So I'm not saying that. But what I am saying is the best ones are the hardest ones, but they love you. It's tough love. They want you to be the best person that you can be. And the one thing I always say is, because I'm very hard. I will be the first to admit I'm very hard, but at the same time, nursing is hard. And I had mentioned this last week. Anybody who has standards for you will have high standards. If they are doing the easy approach and making things easy for you, they don't have high standards for you or for themselves. So if I hold you to a higher standard because I know you can do it and you can be the best nurse you can be, plus you will be reflecting me. Keep in mind, whatever school you went to, you reflect that school when you go out there in the world. And if you get out there and they say, what school did they go to? And they say, oh, they went to whatever school happened to be. Okay, well, we want to hire more nurses from that school because that school's putting out some good nurses versus the opposite of that. So I would say that's why. I mean, it's hard. Nursing school is hard for a reason because, truth be told, if you think about it, do you want everybody to be a nurse? You really don't. And I don't say that to be in a negative way. I say that to be, um, everybody's not cut out for it. The same way you don't want everybody to be a doctor either, do you? Meaning that you don't want everybody who does not meet the qualifications. They are practicing medicine. They making D's. Do you want them to be passed just because we want everybody to be a doctor? No, because they're going to be doing surgeries on you, interventions on you. They're going to be giving you medical advice. And is it even sound? So no, we don't want everybody to be nurses. We don't want everybody to be doctors because we want the best of the best, typically. All right. So what did you say? Do because we're dealing with life. Yes, because we're dealing with life. So many professors are yes. We are dealing with life. And I don't think, you know what? I don't think, and I say this because I have students who tell me this. I don't think students really understand what they're getting into when they come into nursing in the first place. I just don't think they do. And when we're hard on them, they're like, and we expect you to come to class, we expect you to be on time. We're trying to set you up for the real world. The real world is like you can't be coming to late work every day. You can't come in and tell me, well, I got to go to an appointment today and leave. You have to do what you have to do for nursing school. So we're dealing with people's lives here. And if you can't take care, you can't get to class on time. Well, what makes me think you can get to work on time? If you don't care about the fact of why you have to make good grades or try your best in class, why do I think you're going to care for patients well? If you up here being unprofessional in class, why do I think you're going to be professional in the real world? So we want to try to make sure that we want the best of the best. Uh, yes, the BSW will be grounds for advocating. You're right. Oh, yes, you're right about community services and resources, because that's the stuff that nurses don't, a lot of us don't even know. Like, we don't know how to help you. We have social workers in hospital, we have case management in hospital, and typically they handle that type of thing. So you're right, we don't know how to help you. So your BSW is going to be on point. You're going to be able to say, hey, you know what? There is uh maybe they need help with finding shelter because they're trying to be away from somebody. You may know where the shelters are. You are right, Nurse Ultron. That is going to be great for him. Oh my gosh, heal or kill. I'm gonna steal that. I'm gonna have to steal that, Chris. I'm gonna have to steal it. I'm gonna have to steal that one. Nurses have the ability to heal or kill. I like that. I like that. That is so true. Justin, you can be just fine. Um, you can be just fine when you go. You're gonna be great. Yes, so psychology. I mean, I couldn't use it in the sense of how I wanted to use it because I want to be a psychologist. But I think I found my calling through nursing, so I'm very happy. And even though the psychologist has a doctorate, well, I do too now, but it's in nursing and not psychology. But psychology has been a great foundation for me to deal with my patients, to deal with other nurses, to deal with the hatred in nursing and things like that. Yes, I know psych pretty well. I do. I do. I understand it. Um, Justin, if you don't mind me asking, you said you found yourself watching countless Black nurses on YouTube. I'm not trying to call you out, but do you mind sharing your ethnicity, race? Well, the one thing about the Black nurses, we're gonna tell, well, all nurses are actually, we're gonna tell you exactly the one thing about me, I'm gonna tell you exactly how it is. I won't discourage you necessarily from going to school because I don't believe in that. I'm still here. I find that a lot of nurses are going to, they're like, oh, I don't know why y'all come into this profession, this, that, and the other. If you know the good, bad, and ugly, then I welcome you. If you here for money, if you are here, which I don't think you are, but if some people are here for money, because they want, some people on YouTube portray an image that nursing is great, and it is, but they portray the side of the money that we make and us doing the things that we do. We go traveling and we can go to Dubai, we can go here, we can go there, we can buy luxury items, and at the end of the day, it's not about the money, because to be honest with you, none of us make really enough money that our bad days pays for, because we have some very bad days in nursing sometimes. So I mean, I have a lot of bad days. I'm in academia now, and I still have bad days in academia. My school don't do rounding either. So many ladies are in the class because of class. Okay, did I miss something? Let me see something. Miss Good, you said your class doesn't do. We don't do rounding either. We don't round to the. We don't actually don't round until the final grade. So let's say, for instance, our passing grade is a 78, and let's say you have a 77.4, you have failed the class because you have to have a 77.5 in order for me to round up. So I tell people, do their work all the time. Do your work, because when you don't do your work, it messes you up. I will say this as well. Okay, you're Black too. Okay. Um, I will say this as well. When it comes to, this is for Justin and anybody else who's in school, do the best you can when it comes to, like, let's say for instance, you all have discussion forums to do. I don't know if you do, but a lot of schools require discussion forums. If you have discussion forums, once you figure out the layout of that discussion forum, how your instructor wants it to be done, how many references you have to have, and what his or her criteria is for those discussion forums, nail those discussion forums every single time. All those little grades like that, if you're getting graded for it, let those things buffer or bump up your grade, because you're going to need that for your test or projects that you don't quite understand. So I always tell people, make sure that anything that you can ace, make the best grades you can on that, because you may need it to help bump up your grade for your test, that if you're not doing so good on a certain test. Because sometimes the testing is hard. You say you want to know what to expect. I can tell you exactly what to expect in nursing. So whatever question you have, you just let us know. Because I'll tell you the truth. I'll tell you. And if I don't know, then Nurse Ultron that was here, they could tell you too. I mean, they have more experience than I do in nursing, and they actually work ICU and ER, which is great. So thank you for joining us tonight. But I'm totally new to nursing world and the hospital aspect as far as clinical, one of the different rotation units and areas in the hospital. Okay, so it depends on, are you in an LPN or BSN program? I can answer that once I know that. So the motto of your nursing program was not to just teach, but to make nurses, and don't understand until I got it. Yes, you're right. Right. I just don't think some students realize what they're getting into. It seems so fashionable on TV and some of these shows. And please don't watch shows like ER, Grey's Anatomy, all those different kind of shows, Nurse Jackie, whatever the newer ones are out, because they depict nursing in such a way that, yeah, they actually focus more on some of their personal lives, which does happen in our real life. But sometimes what they do in nursing is not really accurate to what's going on. So yeah, well, Nurse Ultron got it. That's pretty much what you have. You have OB, Med Surge, Psych, ICU, L&D. Yeah, you also have. Well, we had ER. So it depends on which. We had ER. We had same day surgery. We had we had so Med Surge and ICU. Our ICU class was our Adult Health 2 class, which incorporated Med Surge but higher levels of Med Surge, which was your ICU. It is no joke. Y'all are right. So that's basically, I mean, you will be going to different rotations. And even for us, when I did psych, we actually went to the jail, a county jail for psych. We went to and that was traumatizing. We went to another mental health place. We attended an AA meeting. So even within your rotation, sometimes you get to do other little things besides in the hospital setting. When we went to Mr. Wallace is here. Um, when we went to where did we go to? Where did we go to? We went to shoot, I can't think of it now. We went to in OB. We went to a clinic, OB clinic. We went to the pediatric clinic. We of course went to pediatric and peds. That was one thing that's not on there. We went to pediatrics too. So that's somewhere else you'll expect to go. I watch Yes, I actually watch nurse. So in one of my classes that I teach, I actually showed them a clip, and Nurse Jackie is who I picked, and I said one of the episodes that they had, and they it was pretty accurate, but I wanted to show also the good, bad, and ugly, like what she was doing and what they were doing that was good, what they were doing that was not good. I showed all those things so that they would know, okay, this is not great to be. Don't do this as a nurse, or yes, do this as a nurse. When you say you lose most of their skills, in what way? Do you mean if they're not? What do you mean lose most of their skills? Yes, Nurse Ultron, I'm glad you're here because yeah, you own it. You own it today. I'm gonna have to use you as my mentor. You know more than I do. Nurse Ultron has 20 years experience, y'all. He I don't know, is it he? I can't see pictures, so I apologize if you're I don't know if you're male, but yeah, I appreciate you helping because you have perspectives that I don't have because you work in a different area, a different specialty. And you also, let's get away from this notion that a nurse is a nurse is a nurse. When I went to nursing school, the old school nurses would always say a nurse is a nurse is a nurse. Those are kind of like your diploma school nurses. Okay, I didn't want to disrespect you, sir. I can't see pictures. Like the pictures are so tiny in my little chat thing, so I'm sorry. I didn't want to disrespect you. Um, but you are on point. I appreciate you because nursing is hard, as you have said already, and you got some experience that I don't have, so I appreciate you. Um, But yeah, so Chris, what you said? Do you feel will lose most of their skills? What do you mean? Help us understand what you mean by. Do you mean by doing what or not doing what? We lose our skills. I do. I had somebody on TikTok ask me the other day. She wants to be a OB nurse or mother baby nurse, and she was afraid that she. No, she messaged me today actually. She was afraid that she wouldn't learn how to do like so Miss Renee, this may help you. She was afraid that she would not be ready to do her like IV start skills and things like that, especially since a lot of people went to school during COVID and when there was no real clinicals and stuff like that. A lot of people had a lot of simulation. One thing I want to mind you is when you go to clinical, um, oh, operating room. I missed that song. I must miss a message in there. I'll come back to that. So when you go to your real job, if learning how to start IVs is the focus of theirs, they gonna make sure you know how to start IVs. And if they don't, what I need you to do is be an advocate for yourself and go speak up and simply just say, hey, I'm gonna go. I would like to go to same day surgery, or I like to go to the ER and start IVs all day. And to start putting catheters all day. So, the one thing about being a nurse, I don't want you all to think that, um, well, you need to be your own advocate. Okay, you're going to ADM program. You need to be your own advocate. That's one thing I will say coming out of school. Be your own advocate. Even going to school, be your own advocate. In terms of being an operating room nurse, where you lose your bedside skills. Uh, I would say to a certain degree, no, you're not doing interventions or things like that, like a lot of interventions in terms of, because you are basically just recovering patients. If you are doing the actual surgery, and if you impact you're recovering patients and sending them to the floor. Um, I guess you could. I guess you could lose some bedside skills. To be honest with you, yeah, you could lose some bedside skills, but you're specialized. And I guess that my point is you're specialized. So when you're specialized, you learn what you need to learn. And if you decide to change into another area of nursing, then guess what you do? They will teach you in that area what you need to know. A lot of the things that you learn from one area of nursing will cross train or will transfer into another area of nursing in terms of your skill. You just add on to what you don't know. Um, I want to say it's not that hard if you just did, PACU or OR nursing and then you go to bedside. It's the hard transition for that would be honestly just going from having to recover and send to the floor to being the nurse who's actually going to take care of the patient on the floor. It's a mindset change, and then you have more work to do. Some schools and hospitals have mannequins with me. Yeah, in our nursing program, we have mannequins and things like that as well. So we actually do all those things um, with our students. This semester, we're going to have, I think, 40 students coming in next month for their first semester. So we have all those things to help train students and help them. But you all will be fine. You all will be fine. Miss Renee's gonna be fine. Mr. Pate's gonna be fine. Everybody gonna be fine. Half of some Dominicans were broke. You know what? They need to invest in some new equipment. We just bought about 3,000, or not $300,000 worth of equipment through a grant for our new health science building. So we have new state of the art mannequins now. Anna. We have a new OB um, mannequin. Her name is Mama Natalie, and we have Sim Juniors. We have two Sim Juniors, two boys. So I think that sometimes they just don't have the money. But you're right. We need to invest in some more up to date equipment. Right. You got your IV experience in the ER. I would say just simply like the ones who are really wanting to, you just simply need to definitely go and advocate for yourself. I want to learn how to start IVs. I want to be good at it. Can you send me while you're in orientation, mind you, while you're in orientation, just go ahead and ask them to send you to ER all day, one day. You'll get it. You'll put in catheters. Actually go to same day surgery. Go to same day surgery. You'll put in catheters and IVs all day long. And by the end of the day, you will be more proficient at it. It's true that a nurse practitioner and physician's assistant are essentially the same, make similar pay, other than titles. Is there a real difference? Yeah, it's a slight difference. Physician assistants are nurse practitioner, depending on the state. Some states they actually can work, but some states, because I just had that question on TikTok. Some states they actually can work autonomously. The FY was a FPA, full practice authority for nurse practitioners. There are some practitioners who actually have their own business. They don't have to work under a doctor or nothing. Most PAs have to work under a physician, though. Most PAs have to work under a physician. Somebody said that in their state that they didn't have to, but most PAs work under a physician. NPs don't always have to work under position depending on the state. In terms of the exact scope of practice, they're very similar, but nurse practitioners are just different. And pay, I'm not familiar with pay. I know that there's nurse practitioners who make upper five-figure, lower six-figure incomes, and I don't know what PAs make. Probably this around the same. Um, I think whatever. whatever makes them happy in terms of what they want to do. Nurse practitioners, are considered to be advanced practice registered nurses, and then I don't know about PAs. I'm not well versed on PAs. Nurse Ultron, do you happen to know about PAs? Because I'm not well versed, and maybe you've seen some in practice come into the hospital setting and their role. If you can chime in on that, because I don't really know much about that. Mannequins. We bought we bought. Let's see how many mannequins we just bought. We bought nurse. We bought not nurse. We bought Anna. We bought. They have names. Matter of fact, we bought Anna. We have Mama Natalie. We have Sim Man. We have two um, Sim Juniors, which is two pediatric patients, and then we have the mama has a baby, so we have that's another patient we have. So I think we at least have six mannequins that we just bought, and those cost $300,000 for six. And all the stuff that comes with them. Keep in mind, there's stuff that comes with them too. So not just the mannequin itself, but all the like the skin that comes with it. Ours we have eyes that you can change the uh we have we can change their pupils to make them dilate. We can change all kinds of things. Our mannequins actually can cry. We can put simulated blood through them. We can put urine in them. Basically, we take a yellow food coloring and put distilled water in them to make them go pee. Put a catheter in them. So our actuals are state of the art. Our mannequins are state of the art. Some of the newest ones that just come out. The whole MPPA versus MD, but you know what? To be honest with you, MDs in general have a complex. That's if you go back in time in terms of what MDs are, they just have a complex. Period. Um, yeah. So I mean, they make kind of the same. So you're saying FMPs where you work at make or where you live at make more money really than the PAs. It just depends. And Mr. Pate, what I would say is you need to research the area. If you are interested in going any of those routes, research the area in which you live or plan to work to see what the rates are there because it is based on the demographics. It's based, not demographics, it's based on where you live. So, like in the South, you may make a different wage than you make in, say, California. But in California, as an example, the cost of living costs twice as much as it does here in Tennessee. So, therefore, when you break down dollar for dollar, we really make the same thing because if as an example, if a gallon of milk costs $5 out there but costs 250 here, it's like it's half the price. So it doesn't cost much to live in the South, and up north it can cost more to live up north than it does down south too. So keep in mind the wages are typically comparable to where you're living to. And there's always a whole MD. We were having that same discussion earlier before you got here, Miss Doctor. I mean Doctor. You're gonna be a doctor one day. I just claimed it. I just called it for you, Cotterell. You're gonna be a doctor one day. I've already called you by that. I did that before. Called somebody a doctor, and they actually went back to school to become one too. They got their doctorate. So the MD thing is basically they feel that they own that title, and they have been educated to a point that they think that they are truly the top tier when it comes to being a provider. They really a lot of them really think that, and they don't really value. Some of them don't value the nurses. They don't realize the nurse is the one who actually does all the work in the hospital setting. So um, that's just kind of how it is with that. Yeah, do some research in Miami. You're in the South too. You're further south than I am. So, and because it's Miami, you may get paid more there because it's Miami if you stay there. So definitely do some research there and find out. And if that's the case, you're probably going to make in that same range that Nurse Ultron was just saying, in the low fives, high sixes, no, high fives, low six, uh, pay salary. And have you ever thought about being a CRNA? Or do you think just FNP what you want to do, or CRNAs make great money too? Speaking of which, um, Nurse Ultron, what made you decide that you wanted to go into ICU? Are you planning on becoming a CRNA at some point, or you just that's it's just ICU your home? That's what you want to do. That's where you're at. I think it's a great career choice no matter what. ICU. I've always respected ICU nurses. And one other thing, Nurse Ultron, what's the beef between ICU and ER nurses? Now that's the question. I heard that ER is considered to be chaos and ICU is organized chaos. So there's a beef between them two always. Yeah, Nurse Ultron is a blessing. I don't know where he came from, but you a blessing. Thank you for helping us. Definitely helping us. I appreciate you. I definitely appreciate you. All right, please keep on. Well, what's you said? That's the question. You talking about the ER and ICU beef? That they always fighting. You said they've been at it for years. Sedated and intubated ERs up to the floor and out the door. Okay. Yep. I don't know. I mean, I don't. I don't really deal with ICU nurses too much unless I have to take my patient to ICU. Um, And believe it or not, our OB patients go to ICU sometimes because I've had DIC patients to go to ICU. That's the reason why even if you all who are going to nursing school, even if you don't, if you know I have no desire to do OB, which is fine. It's not for everybody. Just like ICU is not for everybody or whatever. You will see these patients at some point in that hospital, though. So when you do go to OB, because this is the one thing that my students tell me, well, I'm not really wanting to be an OB nurse. It's not even about that. Learn what you can learn in every single rotation because you will see those patients again at some point. We send our patients to ICU all the time because of the fact that they have DIC. We don't handle that on our floor. I have plenty of patients because I'm in the South and we in Tennessee. I have plenty of patients who start withdrawing from meth or whatever heroin, whatever drug they on. That's beyond the OB scope. So once we get you OB cleared and you start withdrawing and carrying on, and blood pressure's going through the roof, and you appear, talk about you on fire, I'm sending them to the unit. So let them handle that because that's something that they can provide more one-to-one care because our ratio is 1 to 6, and so we I don't have time to do a one-to-one like that. So we send them up there. About patient can Oh my gosh! You know what? This is the patient having you preaching you preaching Nurse Ultron. You know what? I need to pass the collection plate on that because they do that to all of us. If you get an ER patient, if anybody with the ER nurse on here, if you're not this way, then that's you. But from my experience and according to Nurse Ultron's experience, they will sit there and give you this report, and then the patient gets to the floor. And at our hospital, we're waiting on the patient to come. They don't even come to the nursing station and let you know the patient's there. They don't even do a proper handoff. They'll call and give you a report. It's a bad report, but then they bring the patient, and then feel like it's been an hour. What happens to my patient? Next thing you know, you walk by the patient's room, and you're like, "How long they been here? They've been here for 30 minutes." When they're gonna sit there and put the chart on the bed and walked out. Some of them are some of the worst nurses that I have ever met. They sit there and they tell you one thing, and then something else is worse. Like you said, they'll say, "Oh, well, they have a cold or something like that, and they actually have CHF. That's why they sound like that." Like, oh no, we don't do CHF on our floor. It's stuff like that that they do. I do have that issue with them. A CMP or PA, whatever. Okay. Thank you so much. Thank you so much, Mr. Pate. Thank you. I really appreciate that. Well, you do whatever makes you happy. Whatever makes you happy because for whatever reason you were called to be a nurse. Well, we talked about why you were called to be a nurse, but it moves you to the point of being a nurse, and that means right there a nurse or a PA eventually. And whatever you choose means you're going to be helping people to basically improve patient outcomes. No matter what, you're helping people to improve patient outcomes. And at the end of the day, that's all it's about. We all here to do the same thing, and that's really to help improve patient outcomes, no matter which role you take. So I applaud you for that. They don't give you the real deal. I mean, yes, yes, that's exactly what happened to me. They drop these patients off, and you be like, "Whatever happened to my patient?" And then you go to the room, or you have to walk by the room and realize that they there, and then they mad at you, the patient. They mad at you. I'm sorry, I never knew that you were here. Chart still sitting on the bed with them. Bed still high. you know, an IV bag in the middle of the bed or on the bed. They are messy. I mean, I understand that you have to get back to the ER, but you don't have to act like that. Do a proper handoff because otherwise, a delay in care could be something bad happen. They could die in between that period of time. What's IR in the hospital? I just heard the nurse talking about that on YouTube. IR. Nurse Ultron. Do you know what he's talking about? I've heard of IR in regards to a lab, but what is IR? I don't know. Is there? Okay, look at you. Interventional radiology. Look at you. Okay, Mr. Wallace knew. Okay, now y'all know stuff I don't know. Y'all teaching me today. I appreciate that. I'm so specialized. I don't know everything. I appreciate that. This is what this is for. This is exactly why I wanted to do this because sometimes we have to teach and help each other. All nurses don't know it all. So that's one other thing, Mr. Pate and Miss Renee, if you're still here. Everybody doesn't know everything when it comes to nursing. That's the reason why we all are supposed to continue our education, whether it be formal education, whether it be seminars, whether it be conferences, webinars, things like that, because we need to stay abreast. And then, of course, collaborate and network with other nurses to learn more about things. I've never even heard of interventional radiology. That cath lab stands. Oh, okay. That's what we just call it cath lab. Okay, okay, okay. You teaching me something. I'm gonna use that too. Interventional radiology. Okay. I need to take some notes. I need to take some notes. I appreciate that. You are very helpful tonight. Thank you. Thank you. Thank you. Thank you. It's like, what you doing next Friday? Because I'll be back next Friday. I might need your assistance again. This is wonderful. Yes, thank you for sharing. Because I'm right. I'm not gonna. I have my phone here. I'm actually putting in my phone because I'm actually wanting to talk about some of these things when I actually talk about to students they what their options are. So thank you, Nurse Arton. You are a godsend. Yeah. Do you have a yes? Do you have a YouTube? Because I need to follow you myself and see what you're talking about. Okay, well, thank you. Do you have a YouTube yourself so we could follow or a IG that we could follow, see what you do at work? If you do and you don't mind us following you, we would love to follow you either here or on IG or somewhere if you happen to have a platform because we love to support you. We'd love to support you because you are a wealth of knowledge, and not only the fact that you're a wealth of knowledge, we all know that nurse. Okay, all right. Let me look it up right now. I'm gonna go follow you right now. I'm gonna follow you right now. Hold on. Because sometimes I have a lot of male students who they need an outlet. They need to know from somebody who is going through something similar to help them. And I would love to be able to point them in your direction, especially for ICU and ER information where I could say, hey, follow this person on IG. And if you don't mind, I may have to say, okay, and send him a DM saying, hey, I sent you and this is the information or whatever that they want to know. Because I find that me being an educator, my male nursing students kind of get lost in the shuffle sometimes. They just get, and it doesn't have nothing to do with race, but my minority ones for sure. But all male nursing students, they feel so lonely at times because it's just them. They may be only that one person in their class or two people in their class. So I'm gonna, I definitely want to network with you so that I can send you some men because we need more men. Men are minorities in nursing too, so we need more men in nursing because we need more representation. Do you find that Nurse Ultron, just a general question? Do you find that I'm not trying what am I trying to do? Trying to find you. Do you find that men patients, male patients are more receptive to you being a nurse? Like when you walk into the room, or do you find, and this is just a question I always just wonder since you've been doing it for 20 years, are more male nurses, more male patients more receptive to you, or do they prefer females, or does it even matter? And do you have issues with female patients? How did Mr. Wallace? How did that make you feel, or does it even matter? Because let me tell you something. When you get into these kind of classes, it's especially if you are a programs. I mean, especially as you go on and on and on and on, you're gonna find that you can be by yourself a lot, unless you're going into something like CRNA, where it's gonna be a lot of men and you'll have fewer women. But you'll be. This is pretty typical. You'll have a plenty of uh, you'll feel kind of lonely sometimes. And truly, that's how it is even as a minority in nursing. When I walk into uh, a class and I have only when I was in school. Okay, I found you, Nurse Ultron. So I'm gonna go ahead and follow. I sent you a request. All right, thank you for that. I sent him a request. We're gonna end up blowing him up. Thinking like maybe you shouldn't have did that. What's the most challenging nursing specialty? You know what? I think that's subjective. I think that's subjective because, to be honest with you, Nurse Ultron could say ICU is the most challenging. Somebody else in ER could say that theirs is the most challenging. I know OB is challenging. It's not as easy as people think it is. um, not community health, mental health is challenging in its own way because mental health patients will manipulate you and they're very smart. They will manipulate you and have you doing something. I mean, I think it depends on who you talk to. Now, when you say challenging, do you mean in terms of workload? Do you mean in terms of mental mindset? Because I think everybody would argue that they are all challenging. Even med surge is challenging. Okay. You say even the females, I bet you the older women probably like the older, 60, 70, unless they happen to be raised at a certain point in time where they didn't want a male nurse. I bet they loved you too. I know it felt discouraging. I could imagine how that felt. I could imagine. Actually, I already know how it felt, not being a male, but in terms of being a minority. Yes, all specialties have their days because people think that, and I worked postpartum. They think that, oh, okay, you're just taking care of moms and babies. Uh, that's a lie because my mom's be withdrawing from drugs, and you have that, and then you have somebody who is withdrawing. They are bleeding out. They are hemorrhaging. They have DIC, and they withdrawing and carrying on. And I'm trying to get them to the unit, but the physician, the OB, don't want to send them because they just too high and mighty. So I have to call rep response so I can get my patient off my floor. I've got to do some crazy stuff to get patients moved. So it just depends on the day for everybody. He said, even working in hospitals, a black male nurses each another. Yeah, they do. And a lot of times you get close, real close, because of the fact that, you have to depend on one another. And it's great just to see somebody who looks like you. And I tell people in OB, especially when I meet other women in OB, I'm kind of like, who look like me. I'm like, oh, that's my long lost cousin. We usually instantly click because of the fact that you don't see many minorities in OB either, by design or by default. You just don't see them. And I mean, the entire hospital. Oh, okay. Well, yeah, that's not good. Where do you live at? For our unit, we have probably about 100 nurses on our unit, day shift and night shift, and our unit consists of NICU, nursery, labor and delivery, and postpartum, so 4 units. Day shift, night shift, about 100 something nurses. Only 4 of us, and all those units were black. We were all just 4 of us, and we had one division clerk who was black, so 5 black people total. Should I just open? Oh, I was nursing that person second. Um, should I just open? Should I just be open to all nurses? Yeah, I think what you need to do is, um, when you go to nursing school, learn as much as you can because you're going to go through rotations. Okay, it's kind of like when you go to nursing school, it's the jack of all trades, the master of none. So you'll go through each rotation, and you kind of, when you go to clinical, hopefully you'll get to go to clinical because COVID situation is messing clinical up for a lot of people. But when you go to clinical, um, okay, Mr. Wallace, thank you for stopping by tonight. But what I was going to say was when you go to each clinical area, definitely take in as much as you can take in from each clinical area because you just never know, honestly, what you can get from it. And I will say this, I have met plenty of students who've told me they have had a bad clinical instructor. Do not let that clinical instructor turn you from the area that you thought you wanted to do. I've had plenty of people come to me who thought they wanted to be OB nurses, but they had a bad experience with another instructor because maybe they're in an RN program versus the LPN program. And then they get me, they're like, this is what I want to do. I'm excited about it. So do not let anybody, um, don't let anybody tell you or make you feel like you don't want to do something, but go to every rotation with the open mind and say, I'm going to learn as much as I can about this area, and then make a decision at the end of your rotation whether this is something in your little list. Yeah, I think I can come back and do this. Or no, I don't think I can do this. It's not something I'd be interested in. And then, maybe reach out to other male nurses in that area if they happen to do that kind of nursing, just to see, um, what they think of it and what the pros and cons are. I will say this, Mr. Pate, get you a mentor. If you can get you a male mentor. You can get you a female too. As a matter of fact, as many mentors as you can get, it'd be great because you can get different perspectives. But get you a male mentor for sure, because of being nursing, you want to run things off of him about his experiences. But also get you a few other mentors so that you can, learn a little bit from everybody. And I think that will help guide you a little bit. Advice on how students prepare and pass the HESI. The HESI. Let me look up something just a minute. The HESI is a comprehensive exam, as you've already mentioned, and most schools give it. Are you using yours? Is your school using yours as an exit exam? What is your school using your HESI for? Do you have to pass the HESI in order to graduate? Is that what they're using it for? Just because I just want to make sure I understand. All right, so I just looked it up. You can't see this. No, there's a glare. There's a glare here. Yeah, it's a glare. I just looked up on Amazon. Amazon's my place for everything. Look up HESI in Amazon and get you some of these study guides in here. There's plenty of them on here. Get you some of these study guides and start with that. I will always start with the HESI because the thing is, those HESIs, that's going to teach you basically how to study for that test, how to answer the questions, what they're thinking. Okay, I'm gonna show this. This is helpful review. I'm gonna show this. So if any Nurse Ultron posted this right here. I want any male group, any male nurses that you all want to follow that Facebook group. That would be great. So does this group allow? Is this for students as well? Oh, yep. It just says that. Reading is fundamental. I need to read. What those nursing program. Feel free to post questions. Yep. Y'all need to go find this Facebook group right here, and I need to put that down as well. Yeah, they can join Black Nurses Rock. The problem I have with that particular group is, depending, it's a great place. I think that place is a great place, Black Nurses Rock, to vent and to talk to other nurses in general. But sometimes they get into battles over there about certain things, and it's kind of like, okay, you know what? Y'all up here battling about ADN versus BDN and some of these things, and it's not healthy conversations that they're having. There's nothing wrong with agreeing to disagree, but like, can we move past that and realize that we're all nurses and that we can take care of patients the same, and that there's levels to this, that if people want to go back, they can. If they don't, they don't. So I do recommend the Facebook group. People do ask questions over there. I think it's a great group, but just don't get caught up in some of the politics over there. Challenging in terms of patient care and workload. I think back to what I was saying and Nurse Ultron was saying. I think we can agree that every unit has its own challenges, because keep in mind, ICU, the workload is 1 to 2, 1 to 3, depending on the workload. The ratio is 1 to 2, 1 to 3, depending on where you work. But I have heard from some ICU nurses that during COVID, they had 7 and 8 patients. Now, if their workload is normally 1 to 2, 1 to 3, and now they got 7 or 8 patients due to COVID, they're not giving the best care that they possibly can. ER, I don't know what their workload is because I don't know how it rotates. So with Nurse Ultron, if you could speak to ER. Med surg is typically 1 to 6, 1 to 7, but I've seen some nurses who've had to work 1 to 8, 1 to 9. It all depends on where you work. My ratio is 1 to 6, and I refuse to go over 6. And I have said that plenty of times where I was ready to go home. I didn't clock in yet. I said, listen here. When I went to that floor that day, we had 20 patients for 3 nurses. We have a 1 to 6 ratio. I told the nurses up off top, either I take 6 patients and y'all take 7 because y'all shouldn't have took the 2 patients to begin with, or I can go home and y'all can have 10 apiece. It's up to you. And they chose, of course, for me to stay and take my 6 patients because I'm not going to go over my workload. So I think it just depends on the area that you're talking about, because you may say, oh, 1 to 3, that's not bad. 1 to 2, that's not bad. But you better believe that acuity, and that's something else we need to talk about, acuity. The patient acuity is so high. That's the reason why in ICU that they don't have as many patients typically because their acuity is so high. These people are on vents. These people are withdrawing, coming off of stuff. They're intubated. All these things are going on with their patients, and there's probably a lot of one-on-one care that is too high of acuity for someone on the med surg floor. But these patients will have you working. So I would have to say even med surg, just regular med surg, those nurses work. Those nurses work. So I think we all can say there's enough room to go around in terms of what's challenging and what's not. Labor and delivery on a good night I think it was a full here. It was a full moon yesterday. A full moon. There's something to that. There's something to that full moon and bariatric pressure that we have. So I was a pre-entry. I would go get those books. Go to Amazon and go to Amazon and get you those books and start with that. That will help you. Mentors, sure. See that. Yes, get you some mentors. I advise male, female. The reason why I say male is because male are minorities in nursing anyway, because there's not many males comparatively. It's like what less than 10% of the population of nurses are male? I think it's 9. It's very few. Is it 10? Something like that. And so therefore you need to connect to somebody that you can talk to, that you can vent, that you can get advice from, and you need to get several different mentors for various reasons. Sometimes it may be just to run ideas by, and then other times you just want a different perspective, because the thing is, our teaching abilities, so Nurse Ultron's abilities to educate you, or anybody else for that matter, is based off of his experiences and where he lives and the patients he have seen. Mine is based off of my exact same things. I live in Tennessee, so Tennessee has a very high drug abuse rate here. So I can tell you all day long about patients with drugs and how to care for them and things like that. He could tell you about something else different. So I just think that we all bring something to the table and can offer that. So definitely get you some mentors. I think you'll find that beneficial. I think you'll find it very beneficial. All right, I'm going to be on here for about another 20 minutes, and then I'm going to the movies tonight, actually. Tonight, I go to the movies every single week. So tonight, I'm going to the movies. So I got about 20 more minutes for to get to the movies. But this has been great. What other questions do you all have? Or what topics do you all want to discuss in the future if you want specific topics? I had asked that last week, and people were like, oh, we can discuss topics or just have questions like we're doing now. So we talk about anything, really. Whatever's on y'all's minds to help y'all better prepare yourself for nursing and better prepare yourself for um, what's to come, really. What's to come. And really, I want this to be, I mean, of course it's YouTube, but I want this to be a safe place where we can have conversations about things and be open and honest about our experiences. I'm not really I'm very much a straightforward kind of person. I don't, if anybody's watched the videos, then I don't BS around about anything. I'm going to say exactly how it is from my perspective or in general. So if I want this to be a safe place where we can feel like we can have an open conversation about things, and no one is like, I'm afraid to say something, because I wouldn't want you to be afraid to say something or ask, is it really like this when this happens? Like, yeah, it's really like that, but I'm not here to take you away from nursing. So that's one thing. I won't take you away from nursing, but I do want you to go in with your eyes wide open and not go in with rose-colored glasses like most of us do when we come out of school. One thing I just posted on TikTok I want to share with you all, and some people didn't know, is about sign-on bonuses. If your hospital that you're looking at is offering large sign-on bonuses, that is a no-go. That's not a good hospital. There's a reason as to why they can't keep nurses, that they got to offer these large sign-on bonuses. If you're going to take the bonus, make sure you have a plan to pay it back in case it don't work out. I was just told on TikTok that there's hospitals that are offering $40,000, and I have never heard of that amount. $40,000 for a sign-on bonus. That sounds great as a new grad, because you're going to be like, okay, $40,000, I can pay off some debt, I can buy this, buy that. No, you're going to sign. You're selling your soul to the devil. I'm telling you, you are. Do not do it. And if you do it, have a plan to pay it back, because you do not want to stay at a hospital for 5, 6, 7, 8 years when it's toxic there, because it messes with your mental health and your physical health. So be mindful of that. And I'm sure Nurse Ultron could really speak on the toxicity in nursing, especially when you're dealing with all women, mostly women. So that's true too. So we need to be mindful of that. about the sign-on bonuses. That is something that they use to bait you. It sounds good. It's great money. You got to pay taxes on it, obviously, but you will have to pay it back if it does not work itself out. So just be mindful of that. All right. Any more questions about anything? Anything we want to talk about? This has been a great night. I appreciate y'all. I took the HESI back in 20. We got to take the HESI. We took it as a post exit exam. I took the HESI in 2004. It took me 3 times to pass that HESI. 3 times. My degree says I walked in May, but my degree says August. That's how bad it was. So they didn't have these books back then. If they did, we didn't have access to them. So I would say definitely get you this HESI book. Look on Amazon and get you a HESI book or something like that to help study, Mr. Khalid. Any more questions about anything? If not, then we can go for today. This has been great. Oh, wonderful, Miss Bishop. Wonderful. What? Tell me, if you don't mind me asking, tell me what was the inspiration? Oh, absolutely, Mr. Carterell. Absolutely. The same stuff that the same stuff that you experienced in high school. You know how girls were catty in high school. They older, but they still catty. They catty. They cliquish. When I tell you they cliquish, they cliquish. The same stuff we experienced in high school. We all done been to high school. It's the same mess that these women, grown women, do today. They don't like this person. They don't like that person. She's pretty. She's this. It's hateful out here. It's hateful, and I don't really associate with them kind of women anyway. I never did in high school either. I don't do clicks. Um, I don't do and Nurse Ultron. I happen to love hanging around male nurses. And when I went to school and working for real in real life, now mind you, in OB, we don't have many male nurses at all. But if I got to a unit where I was floated and there was a male nurse, I would be with him the entire night. I could not hang with the women because they were so catty. And they're talking about the next nurse and they're talking about this and they won't help her. I'm like, come on, let's go take care of these patients. Like let's help each other take care of these patients. I'm more like, come on, let's do it. The nurse is like, I'm not helping her because she did this, that, and the other to me. It ain't even about you. It's about the patient. But they get caught up in their own personal. I don't know. It's just women are as if I'm not a woman. Can I be catty sometimes? Yep. Am I petty? Yep. But when it comes to taking care of my patients, I don't play about that. I don't have time for clicks. Yes, male nurses do. Yes, they're women. You know what? You said you preaching. You still preaching. It is competitive. Women compete. Women compete with each other, but for what? For what? They do compete. We're very competitive in nature anyway. Men are competitive too. When it comes to you and other male nurses, do you find that y'all have it seems more competitive, or because of the fact that it's very few of y'all are able to lay low and just sit back and watch the women act a fool? Yeah, they're very, very, very petty. They're petty, they're competitive. Um, then there's a whole day shift and night shift, battle that goes on. This nurse, this, that nurse. I mean, they will undermine you. They I don't know. I mean, it's just and then imagine what academia is like. I work with women in academia. It's everywhere. It's everywhere. Women, you just have to learn to get along with them, I guess, or avoid them. I would say avoid them. I would say what I typically do is when I'm around people at work, especially the ones who are very catty, um, I stay to myself. I find out where's everybody sitting at work. Let y'all sit yourselves down somewhere. I go in my little area, do what I need to do, and I just, if I have to interact with them, I say, "Hey, how you doing? You need help with something?" I help them with something. I go back to my little area because I don't get into the drama. Because we've had nurses up there fighting at the nursing station over a man that both of them were seeing. Like, why y'all bringing this to work? Why y'all bringing this nonsense to work? So I just don't have time for it. So just find you some good people to be around, and male or female, and just call it a day. Yeah. Yes, they are. Women are just we're messy like that. Just messy like that. And a lot of it depends on, some of us are more privileged than others, so some of us grew up differently. So when we grow up differently, um, I've met a lot of women who will tell you, because that's not their experience, that it didn't happen. And that's the issue that I have with people in general. Like, okay, just because you haven't experienced racism don't mean I haven't. Okay. And so therefore people are, why is it all about this? Well, because I've experienced it. Okay, good. You found you some money to pay for school. Good. Yeah, I'm happy to have helped been a part of that then, motivating you to do what you want to do in life. Somebody, and that age doesn't even matter, but there's a person who messaged me today on TikTok, and she said, I'm 50, I think she said she was 50 years old or something like that, and she asked me, was it too late for her to go to school? She said, because I'm motivated now. I said, no, it's not too late to go to school. It's never, until, as long as you breathing, it's never too late. It's never too late. I've had people who I've had students who were 60 years old. She was 60 years old, and she was going to school to she was going to retire at 65, so she only had 5 years, but she wanted to get her BSN because she wanted her BSN, and that's all she got it for. So she worked for 5 years and she retired, and there's nothing wrong with that. So you work, you do what you do when you want to do it, and to be honest with you, you'll probably have more of an appreciation for it at this point in time in your life too. And we all come at different walks. I started nurse. I was a nurse at 26, I think. I started a little later than some. Some people start nursing when they're 18, 19, 20 as LPNs, um, or ADN nurses or whatever it happens to be. But I started at 26, which is late. But here we are. I'm 17 years in now. So I'm glad that you are here. I'm glad that you're motivated. You will lose motivation sometimes. Just remain disciplined. I will say that. And just try to get through every semester that you can. Once you get to those nursing classes, when do you think you plan on? You said you have a. Did you just start your prereqs for nursing? Have you started your prereqs yet, Miss Bishop? Oh, okay. Violet Flame, great. So you just got into. Okay, good. You got into a program. You're saying a nursing program. Okay, good. An ADM program. Okay, that's good. How are you enjoying it? Has it started yet, or does it start next month in August? 'Cause that's real good. I'm glad that you were good. Good. Did you now? Is You've already started the program, but have you checked to see what their NCLEX pass rates are at your school? Okay, January due to COVID. Okay, check. Okay, you haven't started yet. That's good. Have you checked your school's NCLEX pass rates? Good. Does it say first time on when did you find this from the school website, or did you find this from the board of nursing? That is very high. That's actually great. That's 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 excellent actually. My question to you: does it say first time? Did you find it? If you found it on the board of nursing. Okay, so y'all familiar with the program. Okay, all right. So for the rest of you, when you're choosing a nursing school, you really want to choose a program with a very high NCLEX rate, but it needs to say first time pass rate on it. Your board of nursing is only tracking first time pass rates. So if you're going to go look for a program, if you're trying to choose a nursing program, um, go to your school of nursing's website online and see what it says their NCLEX pass rate is. If it does not say first time beside it, that is a problem. So, for instance, again, on TikTok, we talk about this all the time. Somebody said their pass rate was 95%, but it didn't say first time. So that means it's 95% after how many tries? If you keep taking the same test over and over again, you're likely to improve. Your board of nursing will say first. Well, your board of nursing always reports first time pass rate, so be mindful of that. So yeah, definitely check your NCLEX pass rates for your programs, because if not, you could be paying all this money for a school with a 70% NCLEX pass rate, and you're wondering why nobody's passing the program. Find that out first before you pick a school. Okay, I'll probably do. I have to be somewhere. Does the online program have clinicals attached to it? Do I have a nursing subscriber email with questions or topics? A YouTube email. I don't. There's such thing as a YouTube email. You done taught me something, but I will give you my business email. I'll put that on here. I'll put that in here now. Um, I didn't know that. And this is where I use for um. Hold up, make sure I spelled that correctly. All right, that is my email that you can actually email me and ask those questions that you have. So that way, if you have questions, you can. Even if you have questions or concerns, or you want to say something about, hey, could you do a video on this type of thing? Sometimes it takes me some time because I have to research it first. I don't like to come on here and talk about things I know nothing about without researching it first, so that I can give you a true view of what I feel about it. Good question. BSN is actually what they consider to be the professional nurse. So they're even teaching that in books that BSN is now considered to be the professional nurse. ADN is not the professional nurse. You're still a nurse, but it's not considered to be the professional nurse in terms of what they're wanting the BSN to be the entry point into nursing, to do away with those other programs. But I honestly don't see it going away, because think about this: we have such a they claim it's a nursing shortage. Just on the TV today here in Tennessee, they said we have a nursing shortage. We really don't have so much of a shortage. It's a shortage at bedside, because when you have 4 million nurses in the United States, we have 4 million nurses roughly in the United States, active licensed nurses in the United States. They're just not at bedside. So the shortage is not in nursing, the shortage is in certain locations at bedside. And COVID took a lot of people out, in terms of like no, I'm not going to do COVID. So I don't see them doing that anytime soon, because of the fact that we got to recover from COVID. And I feel like uh, I do feel like when this fall comes, we're going to have issues with the COVID going back up again, and I am fearful that we may not have as many nurses that we need to care for these patients with the COVID situation coming back around, because we are going to be about into fall and winter coming up here soon, and then of course flu season and all that. So I don't think it's going to go away anytime soon. But they said the same thing about LPN programs, and they're still here too. So don't I don't buy into that. Now, certain hospitals may say we only want certain kind of nurses. So, like um, your magnet hospitals want the BSN prepared nurse. They will hire you as an ADN if you're going back to school for your BSN, like you're sometimes actively already taking classes or things like that. But I don't see it going away. How to make the most of the experience? So that's a great question, Violet Flame. To make the most of the experience is to have an open mind. Have an open mind. Realize that your instructors are human. They make mistakes too. When you first start nursing school, it's going to appear very, I won't even say appear, it's going to be very unorganized. Even for you say you're going to a school in which is a well-known school, it's a great school. I'm assuming the instructors are great. However, it's going to appear unorganized at some point in time. Like, okay, why don't they have this stuff together? They do this every single year or every single semester. I would also say, be have your mental mindset to understand that nursing classes are not the same as your general ed classes, like your English, your history. They're not the same. They're going to be taught at a different level. They're going to be taught at a higher level. And for you to have NCLEX pass rates that high, it it kind of tells me they're probably going to be kind of difficult in terms of the instructors you have is going to make sure that you know what you need to know. Hopefully, they will educate you the way they need to educate you for you to have the best experience possible. Um, but just be mindful that just every time you go to class, ask questions. If you don't understand something, ask questions. If you don't feel comfortable asking in front of other people, email the instructor and set up time during their office hours to go ask them something. I don't want you to be in the mindset that, you know what, I don't understand it, so I'm not going to speak on it, because it's your grade at the end of the day. And if you don't ask questions, the instructor just assume y'all understand. Ask questions, be open minded, go to class every day on time. Do not miss class if you can. Come on, read ahead of time. Read your text ahead of time. If they say read chapters 1 through 10 for class tomorrow or class on Monday, read chapters 1 through 10 for class on Monday and come back to class with your questions, because that's how you learn. You're not going to learn by hearing it from the lecture after the fact. And that's so your study tips are going to have your study habits will have to change too. So I think just the biggest thing is have an open mind and be ready to learn. And sometimes when you come to school later in life, you're ready to learn. Because a lot of people who are younger, you're 20 something, sometimes are not ready to learn. They still want to play and have fun. And usually by the time you're in your late 30s, you passed all that. You passed having fun. You here because you're about to spend some money and you want the education. And I love those students. I love my students who do that. And when they struggle, they come to me and say, I'm struggling, I need help. I'm like, okay, let's set up some office hours. Let's do this, let's do that. Don't be afraid to utilize your instructor's office hours. Because if you need help, you need help. Nursing school, for me, OB was one of the hardest classes that I had, and that's the very class that I teach today. So that's funny how those tables turn. I almost failed OB, but I teach that class today. So I asked questions. I really did ask a lot of questions. Just email for YouTube. Okay, yeah, that's that one right there is the one that you can use. Email me about anything, anytime. I'll see it. I check my emails daily, so and I'll respond to that email. Some of the RN to BSN online programs have clinicals and some don't. Okay, let's go ahead and let me go ahead and tell you this now. The ones that do is the ones that you want. If they don't have clinicals, you don't want the program. Um, wait. So are you saying that you are already a nurse, Miss Bishop? To do an RN to BSN, that means you already have an ADN, or you want a school to get your ADN. Which clarify that for me. Because if it's RN to BSN, that means you are doing a bridge over from a 2-year to a 4-year program. And if that's the case, I don't really care about clinicals as much as I do about a program that don't have no clinicals at all. We need nurses, so right now they're going to, yeah, they're not going to do it with, yeah. So if that's the program you want to go to that program. And they'll pay for it, right? They'll pay for it. They will pay for it. So find you one of them hospitals that'll pay for your education. And then just go to the hospital knowing I'm just going to get my education and I'm moving on if you don't like the hospital. Our students are more well trained. Okay. So then you found you a good school then. If you heard from other hospitals that I just mentioned this earlier. So before I think you were even here, I had said that, the student is a reflection of the school that they went to. So when they say, where did them students come from? And they name that school, they're going to want to hire more people from that school because they're good. They're putting out good nurses versus another school who may not. So good. Participation, yep, it is. It depending. Well, some schools don't allow participation to be a grade, but some do. Ours, we can't even penalize for attendance. So if you don't come to class, we can't penalize for that. So what I do is I do a whole lot of in-class activities that I grade. So if you miss class, you get a 0 for the day because you didn't come to class. Okay, good. You hang with the teachers. Yes, do that because I'm telling you, if they see you struggling, they are now on all faculty are not nice. So I don't want to put that out there because there's good and bad in everything, as you all know. But the one thing I do know that a good-hearted faculty person, if they see you're struggling and they see you trying, they typically will give you more grace than somebody else would. Than somebody who is not. Like I had a student who she ended up with a 77.4 in my class. A 78 is passing. A 77.4 technically is failing. A 77.5 would have given her a 78. I would have rounded up, but she didn't earn that. So when she comes to me at the end of the semester asking me what can be done, because I, want a 78 because I want to go to nursing school, I want to go to the next level. I said, you didn't earn a 78 because you didn't turn in 3 assignments. You got zeros on 3 assignments. I don't have any empathy for somebody like that. I don't have any empathy for that. You didn't do the work. So no, you don't get the grade. And so she failed the class because of that. And that sounds harsh, I'm sure, but that is the reality. You can't get a grade for something you didn't do. Where everybody else did the work and then they actually get the grade. That's not fair to the people who did the work. So I don't play like that. I can understand why you can hate OB. For one, it's an area that people don't want to deal with. Okay, you're going to school with your ADN first, and then you're going to bridge over. That makes sense. Okay, so in that case, you're going to have clinicals with your ADN program. So that's why I say I'm not as concerned with you not finding a program that doesn't require clinicals for the RN to BSN because of the fact that they don't require clinicals because you already did all that already. Now, somebody who's going to an exclusive online program, I'm like, you don't need to go to a program that doesn't have clinicals. It doesn't make any sense to me. So in your case, yeah, that's fine because of the fact that You already had clinicals when you do your ADM program. But back to Nurse Ultron, OB is a specialty. It's it's just like you either love it or hate it. And that was just my passion. I have 4 children, so that's just my passion for me. I love OB. I wouldn't. You can't catch me doing anything else but OB. I somebody did ask me, I think last week, if I could do something else, if I could go back and do something else, what would I do? And I said ICU. I want to try ICU, but I would not go to med surge. I don't want to do peds, which I have done a little bit of peds. Um, I did a little bit of med surge. I did like 3 weeks of med surge, as long as I lasted. I could only do 3 weeks, and after that, I quit. So, but you just have to like it. You just have to like it. Good. You said you had 89 in micro. Okay, yeah. So you see how that works. You see how that works. A lot of times we will bend over backwards for the good students, but if you come acting crazy, they won't do that. I thought about that, Mr. Pate. I thought about that to do a Zoom. That would be great. You know what? Hmm. You gave me an idea. I mean, I thought about it, but I didn't know. That would be great. That way we could be more interactive. That would be great. Let me work on that, Mr. Pate. Let me work on that. I think I want to do that. I want to do that. Let me work on that. So, I don't have a pen on me right now, but I'm going to work on that. I like that idea. I think it would be amazing because we all could collectively kind of talk to each other, and that would be great. Hmm. I think I will. What I could do is do Zoom, like come on twice a week, but we do Zoom one day and do I can still do live another time for the people who don't want to do Zoom or can't because they're at work that day. Like sometimes, I know some of y'all be at the hospital working, but you be on break or something like that. That way you could come in and just kind of say, "Hey, how you doing?" and leave. Versus Zoom, it's like more so you're talking. So I think that's a great idea. I could do that. I think we will work on. I will work on that. Niches meaning the best for people. Okay, hold on. Let me read this again. Can you talk about what? Okay, when you say niches, help me understand. Yeah, that would be. I would. You said you would be down, Mr. Cotterell. Okay, I would. I'm gonna work on that. Could you talk about what niches mean? Get the best for people. Okay, could you read? Could you reword it? Okay, okay, okay. I will follow you. So, okay, what career paths would be best for people who like patients but not intense work politics? Um, before you clinics are good for that because you still have issues in clinics, but the thing okay, you just said no, but not office politics. Okay. I was gonna say you like people. If you like people, I would say a clinic or something like that, or do some type of case management. Where I did case management for like 10 years as a nurse. Um, well, first and foremost, every area has its politics. It's just how involved are you in it? How involved do you want to be in it? I stayed PRN at the hospital because I did not want to be any more and put into the politics of the hospital. So PRN really helped me with that, being PRN, because that means I didn't have to commit any more time to you all, but I still did my job and went home. Um, so I would say career paths. Let me think on that. I'm gonna think on that and do a video. I'm gonna think on that and do a video on something along the lines of if hospital's not for you, what other areas you can go into. Have you thought about yes, okay, that's another one, home care. There's still gonna be some keep in mind though, there's still gonna be some politics in the office when you go back because even with home care, you go to the office for something. You have monthly meetings and things like that. Because that's the same thing I do with case management. We had monthly meetings and when you had all this drama in the office, but at least when you left the office, especially if you work from home, you figured out how your day went, you went, did your job, and you charted and you came back home. So you will never avoid complete politics, but that is a way to deal with or work with patients on your own time and not have to deal with so much politics. And that's what I did with my one of my jobs. And like I said, telehealth will be good too. But just make sure before you do that, before you do any of these other jobs, make sure you go spend some time in the hospital working first. I just personally believe that no matter where you work after the fact, spend at least 1 year in the hospital and learn how that works. And then after that, go out and do what you want to do, because you want to be able to build from something. Because keep in mind, if you're taking care of people on the outside of the hospital, you got to kind of know what a sick patient's like first. You got to know certain things first, and then, because keep in mind, I think somebody was talking about earlier how like we can use community resources. I think Mr. Pate, because he's getting his BSW, he has a foundation because he has probably seen some people and he's interacted with some people. He may even have some clinical or practical hours he had to do. And then he's going to the nursing side of it. He's going to be fine. You know, um, go get you about 1 to 2 years, like you said, and then okay, yeah, get you some experience first, and then go wherever you want to go after that. After that, you'll be just fine. What did Nurse Ultron say about something about C sections? Did she say something about C sections? I thought she said something about too many C sections or something. Oh no, it was Mr. Wallace that said that. So yeah, in OB, too many C sections. Yeah, but that's a surgical patient, so that's med surge. If a C section go wrong or something happens to my patient, I sent my patient to the unit. I've sent plenty of patients to the unit, to be honest with you. Um, okay, yeah, yeah. So C sections. Those are some of the hardest patients to take care of because they've had surgery. They've had abdominal surgery. That's how they got their baby out. So again, that's why I say OB is a specialized med surge. It is what it is. So you weren't traumatized by the natural birth, the regular way to have a baby, but you was the C sections. Have you seen a natural birth, like a real natural birth, or not somebody else you were not with, like a patient? Have you seen a real natural birth? Because some people, for some of my male students, it's traumatizing. I have to get them off the floor if they've never seen a baby come out the natural way. So some people can't handle can't handle that. But I happen to love the miracle of life. I love babies coming out and being born and all that. That's my thing, which is why I'm here. And I do advise whoever y'all are with, not who you're with, whatever career you choose, make sure you have a passion for it, because bad days are already bad. They are always bad anyway. If you hate what you do, it's even worse. So have a passion for whatever it is you do. This is my passion, OB, and secondary is education. I love to teach no matter what. Okay, relaxation consultant. That's great. So then you actually get on an add-on certificate for that, on top of your OB stuff. I'm going I'm going to see Old. It comes out today. Old. It's supposed to be a movie about uh they age. Something happens to them, and like they go to this island or something like that, and they're supposed to age, or I don't know. I saw the previews and it seemed cool, so I'm gonna go see that tonight. But yeah. You have a passion for it, Violet Flame? Yeah, do whatever your passion is. If your passion is, and then when you do decide to do something that is less politics in the community area, find something that's along that niche, as you would say, of OB, of community health, but the OB perspective. I've worked so many different jobs, it's ridiculous. I've always worked. So I had a job which was, well, I don't get into the job name. What the job was we went to go see patients. So once we had, let's say, a mom who was a drug mom or first time mom, we went to the homes. My job went to the home after the fact. She had the baby. And we went to the home and did patient education about how to take care of the baby. I would do the weight to the baby and make sure that the baby was gaining weight appropriately, make sure she was feeding her baby well. um OB. If OB is what you want to do, do OB, because community health you can always get. And really in OB, depending on how you do it, you can actually do community health after the fact. So do OB. If that's because the reason why I say do OB, get the fundamentals down first. Learn learn about everything you can about OB if that's what your area is. Learn about a normal pregnancy, learn about abnormal pregnancy, learn about problems with or complications. Here in the South, or especially in Tennessee, we have a lot of drug moms, and I have to know, okay, how do we take care of drug moms? How do we take care of babies who are withdrawing from the drug the mom took? So learn what you can learn in the hospital, then go into the community and help them because you have a foundation first. Is what I'm trying to say. Also, I'll for you for that. I'm going to see the movie. We're gonna see. We're gonna see. I have to report back and let you know how it went. Um, a doula. Okay, you can just stay in OB your whole life. You can just do all kinds of things with OB. Yep, actually, male nurses do work in OB. I had His name was Carlos. This guy who worked in OB. He was the nursery. Well, he worked in nursery, which is still part of OB, the whole OB realm. And he was just one of the girls to us. We females talk about female issues. So any issue we had going on, women will sync their cycles. So women who work together a lot will sync their cycles. Everybody's cycle comes on around the same time if they always work together. And he would almost like he would start having an attitude around the same time of the month, just like everybody else would, because I guess because of us. And he just became one of the girls. So that's kind of like Carlos. He's one of the girls. We didn't think nothing about him. But yeah, there's some men who work in OB. I actually met one on TikTok who said he was going into OB, and I was like, wow, I'm proud. I was shocked, but I'm proud of him. Is that why they're on the? Yes, the one there on the beach. Yep. And on an island somewhere. Yep, that's what I'm going to go see. Uh, yep. You said like what husband? Condom or work? What we call a work husband or work husband, work wife situation. Yep. Oh, did you? When you had a baby, you had a male nurse. How did you feel about that? Oh, the doctor was male. Okay, I see what you're saying. Okay. Yep. If you happen to like, don't let anything shun you away from doing what you want to do. If you find that you happen to like, and I'm not pushing anybody in that direction, but if you find you happen to like something, then do it because this is your career. You don't know how impactful you could be. Let's say you did want to do OB, and I don't know if you have children or not, but let's say you may be impactful towards a father because keep in mind it's mom, baby, and then she had to get pregnant somehow. So if you have a family situation where it's a father, um, and you may be impactful to him. You just never know. And sometimes we come along this walk of life and we don't know who we may impact. You may just talk to him and things like that. I think you just do whatever makes you happy. Um, yeah, you just do whatever makes you happy. I wouldn't tell anybody not to do something because it's more females in OB and I thought you should go to ICU or ER because of the fact that you are a male. You do whatever makes you happy. So once you go through your program and you say, I really like whatever it happens to be, then that's where you go. And then find you we talked about finding mentors earlier. Get you a mentor in that early and get you a mentor in that area. So let's just say ICU is for you, get you a mentor who's male who works ICU. That would be great. Okay. Yeah, you won't see male nurses in OB a lot, but you will see them. You will see them. You will see them, and they're great nurses. They do the same thing that we all like. For instance, when you go to a patient's room, what do? Knock on the door, and what he would do when he walked into a room, he would say, "Hey, I'm Carlos, and I want is it okay to come in?" Or are you covered? Or something along those lines. You walk into these OB women's rooms and they be sitting there just naked, just sitting there in the room naked. And I'm like, why are you naked like that? This is a public room where people just walk in and out and they just be naked. So he would just make sure that they were decent. He would say, hey, is your nurse Carlos? Is it okay to come in? He would say something like that, and that was his way of that way they knew to cover up type of thing. Oh, I've never heard. Okay, like midwives. Okay, you're funny. So I don't think I've ever met a male. I don't think I've ever met one, but I don't think it's not that you couldn't do it. That'd be great too. I know what you mean now. That would be good too. If that's something you're into. That's advanced practice, so you would have your master's degree and go to midwifery school, and you would deliver babies, and you would have the ability to deliver babies in a hospital, at home, whatever you do. You can have your own practice if you choose to. Um, I know a nurse who she does that, and she has her doctorate as well. She has her doctorate, and she delivers babies. In the hospital setting, they're under physicians. They are under physicians in case something goes wrong. They're always connected to a physician. So, like, if they are, if the mom comes in like something's normal and it's great, but then they have a complication, they have a physician on standby that can come in and assist and help and take over if need be. Or if she ends up needing a C-section, they have somebody who can help, a physician that can come and do that because she cannot do a C-section, but she can deliver babies all day. So yeah, do that. That's what makes you happy. All right, y'all. This has been great. I have to go. The movie starts in 15 minutes, but we have about 15 minutes worth of previews too. So, but I'm also only like 10 minutes from the theater, so I'm gonna have to go for tonight. This has been great. What we will do is I'll be back next Friday. Next Friday is the 30th, I want to say, at 6 p.m. Central Standard Time. So I will be back same time, same place. I am Mr. Pate going to look into the Zoom. I think that's a great idea. Um, I think it's a great idea. I think that I do want to do that because that way we can really be more interactive and really engage, and we can actually have topics and things like that. So definitely, thank you for that idea. I will be working on that, and I will probably get that up and going. Well, I don't want to say because I start working in 2 weeks. I start working on August 6th, my job. So I don't want to make a promise to you that I cannot keep. So, but I am going to work on that. I like that idea. All right. Thank you all so much for joining me tonight. I will see you all next week. And if you don't mind, please thumbs this video up so I can get it shared to more people so I can invite them to the Zoom as well. And until the next time, I will see you all next week. Have a good afternoon.